One of the problems that we see a lot in the clinic with the patients is knee pain. Sometimes they come with only knee pain, and if that's the case, we always have a look at their feet to see if they're flat. We scan their feet and we check their knees, and often they then tell us they've got some back pain, or they may come with back pain and then they tell us about their knee pain. At any rate, obviously we want to make sure the person can function normally, so we check the knees. Knees can have many problems, but some of the simpler, earlier problems in the knee that people have when they first start having pain are very easily treatable with chiropractic methods. So we're applying the same methods to the knee that we would to the spine. In other words, we need to make sure everything is moving properly. We're going to check our patient's knee today and see what's going wrong with it, see if we can feel anything that's not quite right, treat it, and see what else it might need, okay? Okay, so we've had a quick look at her knee, and we found out that most of her pain is on the inside of the knee, the medial side. And so we're going to just check all of these structures around here. Is there any pain as I'm doing that? So the medial ligaments are under a bit of strain actually. So I'm just going to go a little bit further into here. Is it painful there? Yes, okay. A little bit of work in there, sorry. It's a little bit painful when I do this because I'm just making sure that the muscle is nice and useful and not in spasm. This can be painful for the patient. Are you okay?
Yes.
Yes, good. Okay, so this is her problem. I think her knees are a little bit lax, and every now and then she does a wrong move and then her knee becomes painful again. It's painful, I know, love. Okay, this is painful. Sometimes when you go to a chiropractor, you know, some of the little things we need to do are a little bit painful, but most of it, especially the adjustments, are not painful, in fact. Okay, let's put your knee down. So we're going to check that the patella is moving. It's going well, that's moving fine. This is often a problem with patients, that the patella itself isn't moving very well, but hers are still in a very good state. If I put my hand here and you contract here, is that painful?
Painful on the other side.
It's painful over here, but it's not painful under the patella?
On the top of the patella.
A little bit on the top? Okay. So sometimes this is a little examination that tells us whether there is any wearing out on the back of the patella. So the first thing that goes wrong with a knee is that it's misaligned and the patella isn't riding very well in the groove of the bones underneath it. And that is just called patellofemoral syndrome. Once we start getting some wearing out underneath here, then we get various stages of chondromalacia patella. And that means that the cartilage on the back is really disintegrating. You don't have that yet, you're too young for it. What you just have is a slightly lax knee, and the only way to get this not happening would be to strengthen up your leg muscles. Okay? Right, so we're going to tape this knee to give her a little bit of support, especially on the medial side where she's finding the most pain. We need to have it a little bit bent to tape it, that's good. So we're going to put one tape across here to strengthen the knee here. So this one's going to be fairly tight for support, okay? Across the bottom of the patella. There, good. Okay, when you do this, you always make sure that the ends of the tapes are not stretched so they don't come off. And we give it a little bit of a rub so that we can activate the glue properly. That's it, good. Now we're going to make sure that this side, on the medial side of your knee, is stretched. Stretch it nicely so this will give support. That's good. And then we're coming across here to just give some proprioception to the quads muscles in your leg. Okay, this is nice and loose here. Only across there is it tight. So I was asked on Instagram this morning where to get this tape. It's called kinesio tape. And you can get it in various chemists, sports shops, and our patients can get it from the clinic as well if they want to do their own taping later. But you have to be careful with taping that you definitely don't go all the way around a limb tightly, obviously. So there are some things that you shouldn't do with tape, but it's quite a useful way of giving the body more stimulation and a little bit of support. Okay, so keep that on for 3-4 days. You can actually swim with it or bath with it, just don't rub it, and try not to take it off before 3 or 4 days, okay?
Sure, thank you.
Very good, okay. So thank you for watching. I hope this information helped you, and if you have any other questions, please leave a comment below.